You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, laser dentistry, new treatment options for people that are suffering with gum disease or periodontal disease. According to my first guest, no more bleeding gums, bad breath, loose teeth. In fact, if you've been told you may need extractions or you have gum disease, you got to hear what my first guest has to say, Dr. Scott Trettenero. Dr. Trettenero, welcome to the program.
Thanks, Randy. It's an honor to be here.
Well, thanks. Now, I know you brought a lot of photos.
Yes.
And we'll get to as many of those as possible.
Wonderful.
We're talking about laser dentistry today, but your practice.
Yes.
I mean, who's the typical patient that you see? Because you do more than just
I've been in practice since 1980, so I've seen a lot of changes in dentistry, and I've had patients that have been with me for that long also, so I get to see them throughout the years. But my patients come to me because of my experience and technology, and we see all sorts of patients and do all sorts of procedures. We do regular cleanings and fillings and crowns and veneers and partials. And this laser dentistry is something which has really been exciting to me in my practice.
And this is a big topic in dentistry. It's like the newest trend.
Yes.
Which is, I guess, there's two ways to do this, and we'll just jump right in here.
Right.
We're talking about gum disease. First of all, kind of give me a basic understanding or a definition, working definition. What does it mean to have periodontal disease, gum disease? What are the symptoms?
All right, the symptoms are something that have been throughout mankind's history. Periodontal disease is the scourge of humanity, if you want to say that, because it is the #1 reason why people lose their teeth.
And it's treatable.
Treatable now. Okay. It is now. It used to be just dentists would pull their teeth and put in partials and dentures. And we've had periodontal services for a long time, but people don't really accept periodontal services in the conventional form because they know that it's very painful and it's costly and it's almost debilitating at sometimes to go through those sorts of procedures where they cut, scrape, stitch. It's not a fun procedure.
So what are the basic symptoms? Like if somebody's watching this,
yes.
Like how do they know they have gum disease? If they're not going to the dentist, what are the obvious symptoms?
The obvious symptom is bleeding gums.
Okay.
And that can show up when you're brushing or flossing or even chewing hard foods.
But a little bit of bleeding when you're flossing is okay.
Well, Randy, most people think that and they live like that, but that's not right.
Really?
A little bit of bleeding means that there's inflammation. Inflammation can mean that there's infection there. You wouldn't want to have an infected part of your body anyplace else, but in the mouth we just kind of get used to it because it doesn't hurt usually, and for us it doesn't seem to mean anything. All right, so what happens is that there's bacteria underneath the gum line, and this bacteria infects the gum and causes the inflammation. It breaks through that first barrier and then you get bleeding. Well, that bacteria not only is in your mouth and gums, but it also can go to other parts of your body, such as so it
goes in your bloodstream.
And through your arterial system. It's been known that since 1954, that bacteria readily and excessively gets into your arterial system. Another symptom is loose teeth. Teeth can become loosened up because this bacteria actually invades the gums, destroys the gum, destroys the bone which holds the tooth into place. So you lose the gum and the bone support.
So loose teeth are because of an infection in your mouth?
Exactly,
it's kind of eating at the bone that holds the tooth?
Yes, it's horrible.
Really? Okay.
It's horrible. Now, there's other things that can happen is that changes in your bite, not only with the loose teeth, but food can start packing in between places that they didn't used to. You can also get bad breath. And the bad breath thing is not only horrible for everyone around you.
So bad breath could be caused by gum disease?
Most definitely. Most definitely.
Okay.
Yeah, the bad bugs get into the gums, and it's a kind of a rotting effect for your gums, and it comes out of your mouth as a bad breath. Yeah, the bad breath is something that people, if they're telling you that you need a Tic Tac every once in a while, you might want to consider having your teeth checked. Now, what we can do is with the laser, we can go around the gums, destroy the bacteria, and vaporize the diseased tissue in there painlessly. And the bacteria which causes the bad breath is gone, and the bad breath can be gone.
Is that right?
Yeah.
Is that right? So now, after you go around the mouth with a laser, we're talking about laser dentistry for gum disease. So they have loose teeth. You say because the bacteria is kind of eating away at the bone.
Horribly.
So when you go around the mouth with the laser, in some cases the teeth get strong again?
Yes. We can actually reattach the gum tissue to the teeth by getting rid of the bacteria and the infection. And this laser treatment that we use is the only one recognized by the FDA to help to regenerate some of that bone.
Now, there's two ways to do this, I guess. Across the country, gum disease, mostly periodontists handle the advanced stages. They have one way of treating gum disease and fixing it, and then you have a way of doing it with laser.
The new way.
Okay, so how does the old way work, and how does your way work?
All right, well, the old way is still being done everywhere, especially in my town. The old way is cutting, laying the gums back, scraping everything out, even cutting away bone. They're cutting away bone instead of trying to regenerate it. And then flapping the tissue back, sewing it up. It's very painful.
So when you go to a periodontist, this surgery is called what? Just periodontal surgery?
Periodontal osseous surgery.
Okay, so the bacteria is under the gum line. So
Yes.
they cut open the gums, you said flap it out, and then they do
Right.
a deep cleaning.
Right?
Maybe rinse it with some antibacterial stuff or
Maybe,
something?
maybe or not.
Okay.
Maybe not.
And then they have to stitch it back up.
Right. All right, but they're not treating the cause of the problem, which is bacteria. That bacteria can be embedded within your gum tissue. It can be within your system. Mechanical scraping, cutting, and sewing does not do anything to get rid of the bacteria. I've been a dentist since 1980, and I've always hated periodontal surgery because it hurts so badly. And I send my patients to a periodontist, painful, or else they don't even come back. They don't accept it. Because
Like you never see them again.
I never see them again. And that's horrible because that periodontal disease keeps going on and on and on, and they end up having problems. It never gets any better by themselves. So it's very difficult to get rid of that bacteria just by scraping alone. And studies show that just scraping, the scaling and root planing,
That's the standard way they treat gum disease.
That's a standard procedure within periodontal therapies, is scaling and root planing. And if you do that, studies show that the biofilm and the bacteria levels are back within about 7 days back to where they were before. Now that's not treating the cause of the problem. The laser actually contributes to by killing the bugs that are in the mouth.
So when I see on the website, for example, it almost looks like a button you would wear on your shirt.
Yes.
It says no cut, no sew.
Yes.
So we're talking about what?
Well, the regular way of doing periodontal surgery is taking a knife, a scalpel, and digging it all out, cutting it around, and then sewing it back together. We don't do that.
So if it's a microscopic bacteria, you can't cut that out or clean it out.
No, you can't. No. Studies have proven that you can't do it that way.
Now the gum specialist, the periodontist, what did they say about this?
The people
about this laser?
Yes, the periodontist in the know, the leaders in periodontology are switching over to this laser system because they know it's more effective and less downtime, less pain. In fact, I have patients when I do my surgeries, they tell me they didn't even feel anything, which is remarkable to me because I love that.
So when people say I have good teeth but bad gums, what they're talking about is they have gum disease.
Gum disease.
So you could clear that up.
We can clean that up, and this is the best way. It's very exciting.
Okay, good. Now we have a video. I think it's from the manufacturer of like swabbing somebody's mouth and what this looks like under magnification.
Yes.
So let's take a look at the video. What are we looking at here?
Well, Randy, there's a lot of bugs in that slide there. You can see them moving around, and the more motility that we call it, the more wiggling around of these creatures, the more damaging it is to your gum tissues.
So those things that you're seeing floating around, those are the bacteria that eat at the bone?
Those are the bad guys. Those are, yes. You have good bacteria and you have bad bacteria. Those rods which move around and spiral around, those are bad guys.
Okay, so the laser kills those things?
Kills them. It's designed to kill them.
Well, how does the laser figure out what's the bad bugs and what's the good bugs?
The wavelength of the lasers is set to those bacteria. It's amazing how they do.
They have a pigment?
They have a pigment, and it's designed to hit that pigment and actually just vaporize them.
Is that right? Now we have an after slide. So it seems like things aren't moving. Is it because they're dead or they're just not in existence?
No, there's good bacteria. Those little dots there are the good bugs. Okay. So you're always going to have bugs in your mouth, but you want the good ones, not the bad ones.
Now I know you don't, always, swab their mouth, but if a patient sees all these things growing in their mouth, I mean, they've got to say, I got to do this,
yes,
right? Because
yes.
it's kind of gross.
It is gross, and it's horrible, and I feel bad for people who do have it because I know how damaging it is not only to their mouth, their teeth, but also their entire system. Now, we test for specific bacteria using...
Yeah, you have a test.
Yes.
So what do you do?
Yeah, we do a rinse and spit and send it to a lab.
Like a saliva test on the patient.
Test.
Okay.
And they test for all the different bacteria which are associated with gum disease. And there's a certain group of bugs which are really bad, and these guys are the ones which break down the gum tissue more than anything else. By testing this, we also know that those bugs are the ones that get into your arterial system and contribute to cardiovascular disease, such as heart attacks and stroke.
Now, you brought some photos.
Yes,
what are we looking
I did.
at here?
Yes. All right, well, this is a gentleman that had lots of problems, had a lot of periodontal disease.
Wow.
He had missing teeth, he couldn't chew, he couldn't smile, he had bad breath, he couldn't function. So he came in wanting to be fixed up. So we did some laser around those teeth. We did end up losing a few teeth, but the really remarkable thing is we were able to save some teeth that normally we wouldn't have been able to. He would have been in a denture without this procedure. So we were able to do some fixed bridge work and give him a smile that now he's confident with, and he's a changed man.
His gums are healthy now.
And gums are healthy, and he's healthier. Now he's a new man. He can smile, which is huge. He can eat. He can feel comfortable. He knows he's a lot healthier.
Now, like with him, so what did you do? I mean, is that a partial? I mean, what is it?
I did a combination of some fixed bridge work in the front and a removable partial in the back, which is nice and solid because he has teeth to support it. All right, now this is a lady who just had a lot of problems with the aesthetics. You know, grandkids sometimes are the ones which motivate us to do things, and sometimes they point out that you have, Grandma, what's going on with that tooth? Why is it so dark? Well, she wanted her teeth nice and bright and something to smile with and to feel better. You know, as you get older, if you have old-looking teeth, it makes you even feel older than that. So if you have youthful, vital-looking teeth, you feel better about yourself. And this is one of the things that we can do for people, which is so remarkable, is give them better self-esteem, let them smile, feel good about themselves, and feel younger. All right, Randy, I want you to look at what her smile looked like before.
Yeah.
And look at the dark area on that upper right area. She was really self-conscious about that. Right in front, she had some chipped teeth and worn teeth, and they just didn't look feminine enough. Flat teeth and worn teeth like that makes you look older. She wanted a more youthful look. So we were able to, with porcelain restorations, restore her entire anterior teeth, plus a lot in the back, because when you smile, you show more than just your front six teeth.
You also used a laser in this particular case?
We used the laser to go around, disinfect the gum tissue and get that healthy. And also, when we're doing our impressions, it really aids in contributing to that.
Okay, nice. And you say that you fix somebody's teeth, and it's like their life changes. Elaborate on that.
It's amazing. You know, I'm so fortunate to be a dentist. I never thought when I was younger that being a dentist could make such a change in people. And I don't think most people realize that either. When I first got out of dental school, I would tell people, yeah, I just graduated from dental school. And they'd say, well, how long did it take you to do that? I'd go, well, we have to go 4 years. And they'd say, 4 years just to learn how to drill teeth? That seems like a lot. But I tell you what, as a dentist, we can do so many things to affect not only the health of the mouth, but the self-esteem, the self-confidence, the desirability. You know, if you have good-looking teeth, people are more attracted to you. You're able to smile and be more expressive with yourself. It just changes people's lives, and it's remarkable that we're able to do that.
Now, you know, I'm backing up for just a moment. So if, you know, I Googled, there's more than 30 million people in the U.S. with an upper lower denture, right? Would you say that 95% of those, they lost their teeth because of gum disease? This bacterial infection?
Yes.
Okay.
Gum disease has been shown to be the #1 cause of losing teeth. And that is something that can be prevented, and especially now with the laser.
Okay, so 20 million, 30 million people. Do you think, and this is just your opinion, I'll put you on the spot. Do you think that if you would have got them early enough with that laser and made sure they did at-home care, that they wouldn't have lost their teeth?
I know so. And I have patients all the time that tell me, I wish I would have found you 20 years ago, because we're able to save people's teeth now that they have, people say, I want to keep what I have, and that's fine.
Because it's expensive to lose teeth.
It's expensive to lose teeth. Plus, when you lose teeth, you feel older also, and your function is worse, and it's just a whole different way of living without teeth.
Now, you do a lot of dental implants in your practice. You guys have a team approach, like with Dr. Art Molzan, that's actually been on the show with me. You guys work as a team. So you'll do a combination of laser therapy and implant therapy to give them their teeth back.
Dr. Molzan does all my implants for me. I get the teeth healthy, he does the implants, and I restore the teeth on top of that.
Okay, good. Could you ever be too far gone? Like, I mean, where the gums are so bad you can't even fix them?
Yes, and you know, that's the beauty about implants today, is with implants we can restore people's mouths without teeth.
So with dental implants, what if your gums are bad? Can you still get dental implants?
You can still get implants, but you have to get those gums worked out first. You have to get rid of the dental infections caused by this bacteria, and then you're good to go.
Okay, now what about the crowd that doesn't want to, you know, they have gum disease, they've been periodontal disease. Is that the same thing, by the way? Gum disease, periodontal disease?
Right, exactly, yes.
Okay, and they don't want antibiotics, because there's a lot of dentists and there's a lot of fear of antibiotics out there, certain people. Can you do it without antibiotics?
We can do it
with the laser?
We can do it without antibiotics. The laser will actually penetrate through the gum tissue a certain number of millimeters, and when we get that infection all out with the laser, we can use different rinses orally, which don't include antibiotics.
Okay, so the bacteria lives on the surface of the tooth underneath the gum line?
Yes.
And also in the gums?
In the gums.
That's why they cut the gums with the older fashioned way of doing it?
They didn't do it to get to the bacteria. They opened it up so that they could scrape the teeth and get those clean. Okay. It had nothing to do with bacteria.
But isn't it true that they do cut some of the gum tissue in periodontal therapy?
The standard way of
cutting it to get rid of?
Yes, the standard way is to get rid of the diseased tissue, but it's not affecting the bacteria that's infiltrated out through the gums.
So you don't like that old way?
I don't like it. I never did like it.
Is that right? So you hated that part. You said you hated that part of the practice.
I hated that part of the practice, and I wish there was a better way. I always wish there was a better way, because I did not like to inflict the pain on my patients. When I was younger, I would try to do some surgeries, and I said, I'm never doing that again. That's barbaric.
So there are certain, guys that come on my show and they say, well, they refer to the patients, they neglected their mouth, they weren't brushing and flossing. But you have a little bit different take on that. That it's not just brushing and flossing, that if you have a bacterial infection, good luck, and I don't want to put words in your mouth, but if you have bad teeth, brushing and flossing may not help you.
May not help you.
Elaborate on that. What does that mean?
Well, you can't get to the bottom of those pockets where that bacteria is hiding. So brushing and flossing does affect above the gums and maybe a couple millimeters below.
So it's going to help the appearance, but it's not going to get rid of the bad bugs.
Right, right. And what happens underneath the gums is where all the important things work. So you want to make sure that underneath the gums is healthy as well as above the gum. All right, this is a beautiful lady who's been a patient of mine for a long time, and we've...
Looks like she has a pretty good smile.
Beautiful smile, beautiful lady, very wonderful personality. But as we got older, the gums do change, and it's not necessarily our fault.
Well, her smile looked pretty good.
Yeah, but she didn't like it, and that's the main thing. When she smiled, she saw some gaps in between the teeth. She didn't like that upper right area where there were some old crowns. She was showing some margins of the crowns, and they looked unnatural. Her teeth were kind of shifting in the front. There was wear and tear and flatness in the front, and she just wanted to upgrade her smile. So we were able to do a combination of some veneers and some crowns and give her the smile that took 10 years off of her.
It's very nice.
Yes, and she's very happy, and she smiles big for everybody. Now this is a lady that, as you can see, had some real problems with the aesthetics. Tons of old fillings in her mouth. They'd been patched and patched and patched, and she didn't really want to do anything with them other than patching. Finally I said, we can't patch these teeth anymore, and you're going to need some crown work on these teeth. So she accepted, and look at the results before and after. She's very happy with that look. Here's what we did. We cleaned her gums up. We used the laser around to disinfect and get the gums healthy, because a healthy gum is mandatory for a good-looking, healthy crown also. So we were able to crown those teeth and get the gum line all perfect, And look at the result there. What a difference.
Very nice.
All right, Randy, this is a feel-good story. This has a happy ending here.
All right, all right.
All right. This is a guy that we just could not save his teeth for a number of reasons. Not only just gum issues, but there were some other problems going on. He'd been losing teeth, and he couldn't chew. We were able, with dental implants, we were able to give him a smile that not only is functional, but look at him. Look at his after effect.
Nice.
Changes his life. Look at that hair. He feels 15 years younger, and he goes around.
What do they say when this is all over?
He said they're one of the best things he ever did in his life. He wished he would have done it years ago.
Now, on the before photo, that's pretty bad. That's got to be unusual.
No, not really, because a lot of times you don't see people's teeth, because people like that don't smile. They don't show their teeth. They're always hiding it some way or holding their lips so that you don't see it.
Okay.
So there's a ton of people out there.
Do you spot it? Like because you're a dentist, can you tell who's hiding their teeth?
Oh, of course. You can see the mannerisms and, laughing with their hand over their mouth or not showing their teeth. If you're happy and you've got good looking teeth and you're willing to show it, you're going to show them.
So back to gum disease. Okay, so we're talking about lasers in dentistry. This laser kills the bacterial infection.
Yes.
So people that are headed to dentures, people that are going to lose all their teeth, if you catch them early enough, with the bleeding gums, the bad breath, loose teeth, you can go around the mouth with a laser, kill the bacterial infection, kill the bad bugs, their teeth get healthier, and you could save them from losing teeth.
Yes.
Is that right? That's pretty much how it works.
That's it. We're into helping people save what they have if we can.
So I have periodontists that have been on the show that use a laser, and they swear by it. They use your same approach. They say, Randy, they've used terms like that cutting open the gums, opening them up, and then deep cleaning or scraping this stuff off the teeth and then sewing it back up. They say it's like barbaric. That the periodontists are kind of matching what you're saying, mirroring what you're saying, that the laser's the way to go.
It is.
But they also say, but the problem is people with gum disease have other problems. They need crown, they need bridge, they need extractions or implants. So they have to send them out, right?
Right.
Now you do both. And so that's a big advantage.
That's a huge advantage that I can do all that. I can do what they do, and then I can do everything else at the same time, so they don't have to go to other places.
Okay, good. So it's all done right there.
Right.
Now, we have a clip of the way gum disease is normally treated. It's an animation, and how you're doing it.
Okay.
So let's take a look at that.
Let's do it.
The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
Very interesting. So, but I guess the main thing, I mean, you have patients that go in your practice. The numbers, like the hygienist will say 4s and 5s and 6s.
Right.
What are they measuring there?
They're measuring.
We've all heard those numbers.
They're measuring how far they can probe underneath the gum to where it hits the bottom, to where it's attached to the tooth. So we'll measure them in millimeters. So 1, 2, and 3 millimeters, that's good and healthy, because the toothbrush and dental floss can get down there and clean everything out. Once it starts hitting 4 and 5 millimeters, we start to get a problem. That's when the bacteria...
So 4 and 5 millimeters, you're talking about that the gums are moving away from the tooth.
Exactly.
That's gum disease.
That's gum disease,
okay.
Yes. And
so when they're like saying 5s and 6s, those numbers in the hygienist, they're actually saying, hey, your gums are moving away from your teeth. Right. You have gum disease.
You have gum disease. This is a measure of gum disease. So when we're going down underneath the gum and we hit that 5 and beyond, ooh, that's bad. That's when the bad stuff starts happening.
But you say some patients just say, you know, I just want to get my cleaning.
Right.
Like they ignore it.
Happens every day. They come in, I don't want anything, I just want my teeth cleaned. No, we can't do that because you have a real problem, and we can't be responsible for neglect. We don't want to neglect your mouth like you're neglecting it right now. Well, when we're probing and we find these pocket depths of 5 and 6 and beyond millimeters, they're going to end up losing the teeth because periodontal disease is progressive. It keeps marching on, whether you feel it or not. And that's the thing, is most people don't feel that they have a problem. If they're not having pain, they think that everything is all right. But that's the bad part about gum disease. It's usually silent, and it usually has no effect on people until it's too late.
So people that lose their, like the 20 million plus people that lose their teeth, in the future, let's say 50 years from now or 100 years from now, everybody might have a laser.
Oh,
right?
Let's hope so.
You may end tooth loss in the future?
Yes.
I mean, that's caused by gum disease?
Yes. In a perfect world, if we had the state laws, and I'm from Florida, so the state laws, the hygienist can't use the periodontal laser, but we can dial it down when we're cleaning people's teeth and disinfect each time. It would be a godsend if we could do that. I can do it, but the hygienist can't do it.
Okay, so no more gum disease. No more tooth loss.
That's what we're hoping for.
Now, one of the things we talked on the phone, we talked to the green room, is if you have this infection in your mouth,
yes,
you say it affects your immune system.
Exactly.
And I know this is a big part of the practice that you explain when you're face to face.
Right.
We have about 30 seconds left.
Okay.
If you have gum disease, how is it affecting the rest of your body?
All right, it's been proven that gum disease can actually, the bacteria from gum disease gets into your arterial system, causes a chronic inflammation. Chronic inflammation is the key to a number of diseases, including heart attacks and strokes. In fact, research are saying that up to half of all heart attacks and strokes are initiated and caused by dental bacteria. This is a challenge for dentists, and we have a responsibility to our patients to not only help them to have healthy gums and teeth, but also help them have a healthy body.
Now, I've had some medical doctors tell me that the bacteria in the mouth is found in the brains of Alzheimer's patients.
Yes, it is.
Is there truth to that? You've heard that?
Yes, it is. And also,
this is a big topic. I know you love talking about this part.
Yeah, it's huge. And they also have gone into the clots of people who've had heart attacks and strokes and analyzed what bacteria is in those clots. And a huge number of them have bacteria that can only come from the mouth.
Okay, now look, we talked about this, and I know you publish papers, I should mention, on gum disease, things like that, but prevention is a tough thing to sell.
Yes, it is. Yeah.
It's like, you know, preventing type 2 diabetes, Alzheimer's, things like that, but getting people out of their symptoms, no more bleeding gums, bad breath, loose teeth, no more tooth loss.
Right.
With the laser.
Right.
So find a laser dentist, find somebody like you.
Please.
Okay, good. Now, final message, somebody watching this, they have bleeding gums, the bad breath, loose teeth, all of these issues, but for whatever reason they're afraid. What do you say to them? Or maybe they don't believe it.
All right, well, if they have any doubts, please call me. We'll have a nice consultation. We'll talk about the benefits of laser therapy for them and see if they're a good candidate for it.
Okay, good. I want to thank you for coming on the show. Very interesting.
Thank you,
Good
Randy.
stuff.
All right.
You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.